Welcome back. It's Wednesday, which means it's your Eye on Health with Dr. Sudip Bose, Medical Center Hospital. Doctor, thanks so much for joining us today. We have a car out here. Is it playtime?
It is. Today's topic is ADD, or Attention Deficit Disorder.
Right.
So you, Robert, you are this car. You're pretty sporty looking, actually.
I like it. Yeah, I'll take it.
So let's try to explain the concept of ADD here. So you are driving down the road.
Right.
And as you're going down that road, there are different roads going off in different sides. There's one branching to the left, one branching to the right, but you have to stay focused on your train of thought or your task, okay? So for instance, right now, our task is to focus on this recording and educate our audience. But what happens when you have ADD is your internal GPS, it goes haywire. Right. So instead of keeping that car going straight, it starts going off on one road, on another, and can't stay focused on that road or that task at hand.
Right.
So instead of us focusing on this, hey, piece of lint on your shirt here. Did you watch that TV show?
Let's focus here. Let's focus on the
ADD squirrel.
There you go.
Chicken.
Right.
Yeah. So you lose your train of thought.
You don't want to be in that car because you'll never get to your destination.
Exactly. So you got to stay on your path.
Right.
And this is what patients with attention deficit disorder they struggle with.
Yeah.
And so the main thing here is to realize that this is just the way the brain is wired. It's not anyone's fault. Parents often blame themselves, and they shouldn't blame themselves. They should instead try to recognize the symptoms and go seek help. And you know what? You can get ADD just trying to figure out where to go to for help. I mean, there's you go to your MD, your DO, your PsyD, your psychologist, your teacher, your social worker. Who do you go to?
Right.
It's a jumble. And so I think a good place to start would be to go to your primary doctor.
Okay.
And they can point you on the right road and tell you where to go, whether it's medicine of some sort. And interestingly enough, the medicine treatment are stimulants. So you would think that's kind of strange that when your brain's going in all different directions, you're giving the brain a stimulant.
Right.
But what it does, those stimulants, is they stimulate the part of your brain that tells you to sit down and focus on your job.
So kind of
brings you back.
Your focus in.
And if you don't want medicine, there are behavioral therapies as well. So a few things you can do, but I think the main thing is just recognizing it and not blaming yourself if you're a parent, and going and seeking that help.
Absolutely, and start with your primary doctor.
Right.
Yeah. All right, doctor, thanks so much for joining us. Great description, I like that. Like I said, the car you don't want to be in, right? Because definitely get help, and there are different ways to get that. Thank you so much. And if you have any questions you have at home you want answered here on the front page, we cover anything medical health related. Go ahead and submit them on the email there at the bottom of your screen. We'll be right back. Stay with us.